Talk about.
Hey y'all! Hey y'all, so what's up? I'm with one of my bestest co-worker friends ever. And I decided, I was like, oh, this is a perfect time while we are waiting on the GranuFlow tank to do its thing. It's automatic, but it needs our presence, okay? So this is Taisha. Say hi, Taisha.
Hi, everybody.
All right, requunk. I'm actually a little sleepy, but whatever. Anyways, so I asked Taisha. Taisha has been doing dialysis for how long? April?
No, not April.
May,
June, July, August, September. So it's been.
Oh, it's almost okay. 5 months. Feel like forever, don't it? Feel like a long time.
That's pretty good.
She has been doing dialysis for 5 months versus me, who was doing dialysis for a year and a half, and then I left, and then I came back in April. So, Taisha, tell the peoples what is something that you wish you knew before starting dialysis.
Something I wish I knew. One little small one, just a little one.
What it is?
You don't realize how much of an attachment you get with your patients.
Ooh.
To the point where certain situations come up to where, like, you see them just thriving and they're doing really well with their treatments, to the point where their bodies just decide to just do what it naturally wants to do and shut down, and then you might lose them, and then you have to feel that separation of not seeing them anymore, like they're really gone. I know it's something that's like, it's human nature. We know that it's gonna happen. We all have an appointed time, but when you just get so caught up in working and you're just so used to seeing your patients and you get into a routine, you don't realize that some are really, really that sick in their bodies, and one day they might just go. So you're not prepared to lose a patient. Because every time I feel like we've lost one, I just feel really, really sad.
Ooh, say that again. Y'all, the last one we lost.
It hits you.
I was like.
Because it was like I could have sworn I just saw him.
But I also saw his decline. Once I see if I am able to see their decline, to like kind of piggyback off what Taisha's saying, then that's when I start emotionally detaching, which I'm pretty good at not getting emotionally attached to them anyway. But you're not good at that. I'm pretty good at that, because in my mind I'm like, I don't want that. I don't want to take that home. That's too much emotion. Like,
you
I don't
carry it with you. It's really
I don't want it.
Not good, especially if you're considering being in this field for a while. It's gonna happen.
Yeah, and I'll legit cry like here, and I be trying to get them to cry with me, and they don't be crying.
It's like, no, Ebony, not right now. Not right now. This is shift change.
We was in the middle of changeover.
No, ma'am.
When one of the patients passed away. When I came, so I was going from break. I came back off of break. I came and my manager was sitting here, and I opened the door, and she was like, I was like, what that mean? And then she told me, and I was like, what? And so then I'm like, okay. Talking to our other coworker, Monica, we got to get her on. But we was talking to her, and then I'm like, come on, cry with me. And she was like, no, Ebony, I don't have time for that. I have to focus. I was like, I can't do this.
It will completely throw you off.
I couldn't do it, y'all. I was like, I can't do this. I walked off. I cried. I boo-hoo cried in the water room for like, it probably was literally like a minute. I'm not even gonna lie, not that long. I let it out though.
It's so tough.
Then I came back. I was like, okay, y'all, I feel better. Let's go. And they were still looking sad. You gotta let it out. Is that the only thing though? This was the only thing you want to tell somebody that's never done dialysis ever, and you're 5 months in?
I want to say that.
And she speak up though.
In training, you're not taught this. This is just something that you just have to develop as you work on the floor. Leave your feelings at the door. Set your pride aside. Go put your ego on a shelf.
Is that
because
3?
It does not belong here. Never, 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 never should you ever come in with that on your shoulders. It doesn't matter what position you hold, whether you are a nurse, charge nurse, tech, LPN, whomever, dietitian. It does not matter. Your ego has to be set aside before you walk through these doors, because these patients will break you down. Not like that. I'm just teasing. But no, what I mean is just like,
some of them.
dialysis can be pretty difficult at times.
What would you say is the most? There are a lot
of challenges. So
is there one challenge greater than the other?
I feel like this is like set aside for like, it's like a per person kind of thing. My struggle was time management, and I kind of feel like that'll be everybody's struggle, because you're just learning all these skills. Everything can be pretty technical. There are a lot of steps that you have to remember. Everything is strategic, and you really just got to make sure that you keep up with timing. Timing is everything. All
at one time, because it's like everything come at one time. Like you're doing like multitasking on 100, like on steroids. You're doing multitasking on steroids. Like
it's like everything is good, fine and dandy. First shift, you put all your patients on, everything's good. Then all of a sudden, time is winding down, and you got to start taking these patients off. But let's remember, there's a second shift coming in, and there's 4 more patients you need to put on. So it's all about balance and timing, making sure you're on point with timing, because timing also determines whether your patients will like you. Because let's be honest, the patients who really, really like you are the ones who you let come back. And
let them come back early when you is struggling. Like you need that. Sometimes you need that little 5 minutes,
you do.
Or even that 1 minute.
It's so crucial.
Before they be like, oh, can I come back? No, your time is actually not for 30 minutes. Technically, by policy, we are not supposed to put you on. If we're talking policy, you're not supposed to get on except for like, it's like 15 minutes early or 15 minutes late. But they be trying this 30-minute thing, and it can, like, that doesn't happen every day.
It can make or break you. It's only when the Lord above just sends an angel down to say, hey, daughter, I got something for you.
My daddy's calling me.
Mr. So-and-so is going to skip his treatment today, so you got that extra window. Get in there, daughter. You got this.
Listen, when they miss their treatments, one, I be like it may sound insensitive, but it's like
so bad.
I can't make you take care of yourself. Like I can't physically make you, I can't emotionally make you. I can only educate you and let you know that I care for you, to the point of like, as soon as you get here, I got you. But if you miss your treatment, like this is how I tell them, like when they miss their treatment, I don't even really make a big fuss about it. I'll just kind of ask them what's going on in their life. 9 times out of 10 is something going on in their life outside of dialysis. Like,
they know how important that is for them.
Outside of dialysis, like dialysis for them is like they have to like form their life around it. Versus us, we're not forming even as like staff, we're not forming our life around it. Like we're just making it we're just adding it to our schedule. But they're like literally forming their life around it, because if they have a bad day, then they could be sick the rest of the day. And if they have a good day, they can be great. So when they don't come though, and you know like second shift about to come on, you be like, oh, yes.
Rejoice inside. What a relief.
Listen, you can set up, or you can set up for that patient that's coming behind them. Then you ain't got to think about another setup.
You can take your time to test that machine. You're not rushing.
Hallelujah.
It's like,
hallelujah. It's great. Well, we're going to think of more topics for when we have more downtime like this. We're closing the clinic. It is time to go home, okay? So I hope you guys have a great, awesome day. Remember, it's Taisha. We be pumped. We be pumped.
I be pumped. And her energy just transfers to me.
Cause I be like, I cannot be boring. We just be doing too much. We move too much. We actually kind of experience a lot. emotionally,
in these 5 months that
Yeah.
I've been working on the floor.
and physically. You go through so much to where, like, you really need each other. Like, this is one of my people. When I talk about, like, people that you get to lean on, this is one of my people I get to lean on, and then she gets to lean on me. Like,
you need it.
Like, when we having a bad day, if I'm having a bad day,
look over the next pot, like, eye contact, and we see each other.
We be like, "You good?" You be like, "No, I'm not good." You be like, "Ooh, what's going on?"
Seriously, you need that. Hone in
So,
on that.
ooh, I ain't always had this, so I greatly appreciate having this type of relationship. So I hope that if you are new to dialysis and you are coming in, that you find you a nice bae partner friend. Find you your person, find you a friend, and y'all link up and connect, and you know, don't exclude everybody out now.
That's right, don't do that.
I mean, they gonna feel like outsiders anyway, because they be haters. But
stay open-minded.
They be haters, okay? But when you find your person, then stick with them, communicate with them, and y'all just become one on the floor.
Yes.
But that's it. Y'all have a great, awesome day.
Bye, guys. Thank you.
Bye.